Good afternoon, future clients. I've decided to take this opportunity to let you know even more about Field. You've seen me before on a live pod, and I decided to bring my crew with me this time. Today we're going to have an open forum about what Field does, how they got involved, and a little question and answer series that I think you would be most interested in. It's just another way to get you in the know of what Field is all about and how we intend to proceed in the future.
I'm a retired social worker. I have a degree in social work from Texas Women's University. I also have 30 plus years experience in working with the Medicaid for elderly and disabled clients with the Texas Health and Human Services Commission, which in the past was the Department of Human Services, and way back in the day, the Department of Human Resources. So my expertise is working with elderly and disabled.
I am a registered nurse with many years of background in oncology and med-surg. I am currently a faith community nurse as well, where my goal is to improve the health and wellness of the pastor and congregation. Having talked with Faye about Field and learning what it was all about, it really sparked my interest, because those are my concerns too, with our aging population, meeting their needs and making sure that that they know that people are there for them.
Hello, my name is Dolores Sadler. I am recently retired from Houston Community College as an educator and program director for 15 years. And before that, I had 30 plus years of experience as an oncology nurse at MD Anderson. I retired and I was contacted by Faye Franklin in regards to serving with Field, Inc. And since my desire is to work with seniors and actually work with anyone regarding healthcare education and needs, and since my oncology background trains me to be compassionate, caring caregiver, this seemed to be the perfect opportunity both to partner with her for the phone calls, and especially related to looking at the extended services whereby we will be able to provide in-home care for seniors. And so with that in mind, I am eager to get started.
And let me just bring our viewers up to date. Field started out as a regular live answering service. Phase 2 of Field, which is just for seniors. And that phase takes away the prompt and the research for the senior citizens. But now let me just preference that by saying most seniors don't access the intranet, and they don't like to hold and be prompted through the system to get to what they need. Field has a directory that is caters to the senior. So if they're looking for sad shoes, I do that for them. So they don't have to go through and prompt the system or Google search for what they need. With that came the part A of Just for Seniors, which was the Compassionate Care Unit. And these individuals have joined forces with me to develop the compassionate care. And let me just give you a little bit about the Compassionate Care Unit. We train our own staff to either be compassionate operators, the actual compassionate care assistant, or we are equipped to certify them through faith Christian nurses.
Faith community nurses.
Faith community nurses. So at this point, I'd like to dig a little deeper.
The plan is to hire people who may be in need of a job, who are not just looking for a job, but are looking for an opportunity to enrich the lives of seniors. These can be people who have experience in health care, whether it be in a facility or a one-on-one in someone's home, or it could be someone who has no experience. Our goal is to train them in two areas. One is to be a compassionate caregiver. That is not just someone who provides care, but someone who provides care with compassion, the ability to listen, to discern needs, to respond to needs. And then, of course, the other involves a skill component, which includes the ability to monitor vital signs, make beds, do limited house cleaning, facilitate other needs such as meals for the senior. And so with that component, it has two phases. One is to offer an opportunity for employment, and the other is to provide a service, in-home service or in-facility service for a senior. A lot of times people need services they are not able to get on with Medicare or Medicaid, and so our services can be individually paid for. In the future we will be able to bill Medicare or Medicaid, but at this time I know that there are a lot of people out there who would like to provide services for their loved one, and they don't qualify for Medicaid, and so we want to meet that need.
Okay. And Dr. Horace, could you tell me a little bit about the faith community and how that ties into Phil?
What we found is that several churches are interested in developing a wellness program. So what we have put together is a curriculum for registered nurses to become certified as a faith community nurse. And this is where they are trained over a 6-week period to assess and meet the needs of their congregations. We have a training in place for that, and you can contact Phil, and we'll come out and meet with you for a consultation, and then look at what needs you really need to put together. There are some churches that don't have a registered nurse in place, so what we also can provide is information and training for you to develop a wellness program based on the size of your church and based on the needs of your church as well. So we have both of those. One for a professional nurse to be trained, and one for a lay person that can develop a program within their church.
That brings me to the compassionate care. And if you would, Dr. Sadler and Gwen, pipe in at any time. Tell me, how do you train someone to be compassionate?
You really can't train someone to be compassionate. People that we intend to hire to work for Phil will be interviewed, and I think you get a sense of a person's compassionate spirit, if I can say that. It's an inborn kind of thing, and you can tell whether or not someone really enjoys working with seniors or working with anyone to provide service, how they talk to people, how they relate to people, as opposed to someone who just does it for a job. The part that we will train for is how to listen to a conversation with a senior, and basically to listen for what they don't say, how to look at their movements, and how to determine the relationships within the facility or the home that they live, how to look at safety needs, and how to look at how they interact with other people, other family members, or if there is an interaction and if they need more support. So that part comes with training basically to be observant, training to be sensitive to needs, training to be sensitive in the way we communicate with others. And so that part will take place through a series of classes and actually interaction kind of classroom participation.
And I'd like to add too that compassion first began just through our phone calls. Having observed Gwen making her calls, although she's not looking at the person, she's able to discern from their voice, from their just her conversations with them, if they are the same as they were on the last time she spoke with them. And she's also able to discern if there's something in their voice, something in their speech that needs some immediate attention, and then she follows through on that. Would you like to say something?
Well, I agree with what you and Dr. Sadler said, and it's just, I guess you would say an innate thing. And we as professionals in our particular fields can see that in a person and
Pick up on it.
Mhm.
Again, I say I'm just ecstatic that they have come alongside to a company that is for profit, and yet this is all volunteer work. So hats off to each of them, and I cannot tell you how thankful I am that they have joined. And might I add, we're running it strictly by the books. Gwendolyn keeps a log on a daily basis of the phone calls that she has made. They are documented, and this is for the help of the family. So at any given time, she can recall the conversation that she had on November 27th as it relates to what was taking place then. And that is so that the family knows that we're taking every entity of the Compassionate Care Unit serious, because we care about your senior as much as you do.